They took $1 billion from sick people to win an argument. Last Tuesday, the United States government reached into the healthcare of some of the poorest people in the country and pulled out more than $1 billion. Not from a bank, not from billionaires, from Medicaid, the program that pays for disabled kids' care, a senior in-home nurse, a birth of someone who couldn't afford the hospital otherwise. And here's the part everyone's already fighting about. They only did it to 2 states, California and Minnesota, both run by Democrats. One side says that it is fraud. The other side says it's revenge. And you're supposed to pick a team and start yelling. I don't want to do that just yet. I want to show you the thing underneath the yelling, because whether or not you like the people it happened to this time, a machine just got tested and it worked. What actually happened? Let me give you just the facts first, because this only lands if the facts are all clean. On Tuesday, July 21st, the Healthcare Secretary, Robert F. Kennedy Jr., stood at a press conference next to the head of Medicare and Medicaid, Dr. Mehmet Oz, and they announced that they were pausing federal Medicaid payments for exactly 2 states. To California, about $867 million, and to Minnesota, $200 million. Over $1 billion in total held. The reason, in Kennedy's own words, is if those states want that money, they need to provide documentation that these payments are legitimate. Suspected fraud, missing paperwork. That's the official story. It sounds boring, sounds like an audit. Hold on to that word, audit, because in about 2 minutes it's going to all fall apart. The one number that tells you everything. Here's a number that turns this from an audit into something else entirely. Medicare and Medicaid asked all 50 states to re-verify their high-risk providers. 50 states, totally normal, boring, do your homework request. Then they withheld from money from exactly 2. 50 states got the letter, 2 states, the 2 that didn't vote for this president, that sued his administration constantly, that he names in speeches, those are the 2 that get their money frozen. If your teacher gave the whole class the exact same assignment and the only failed the 2 kids who talk back, you wouldn't call that grading, you'd call it what it is. That's the tell. Same rule for everyone, but the punishment is just for 2. Let me steelman it, because fraud is real. Now, I have to be fair, and I want to be, because if I'm not, you shouldn't trust the rest of this. Medicaid fraud is real. It is not a talking point. Improper payments in these programs run into the tens of billions of dollars a year. That's the government's own auditors saying that, not me. States genuinely do send sloppy paperwork. Providers genuinely do overbill. Asking a state to prove that money went where it says, that is a completely legitimate thing for a government to do. So if this were 50 states getting the exact same scrutiny, I'd be defending it. I'd be the annoying guy that said, actually, these audits are good. The problem is that it isn't an audit. The problem is who these guys are choosing to audit. Keep the standard, drop the targeting, and I've got no video. But they didn't, so we have one. Audit versus punishment. So what's the actual difference between an audit and a punishment? Because from the outside, they can look identical. Same forms, same language, same we just want documentation. Here's the difference. An audit is neutral about who it catches. A punishment already knows who it wants. 2 things give it away here. 1, they provided no evidence of actual fraud. Reporters asked and the administration didn't show the receipts. You don't freeze $1 billion first and then go looking for the crime after. You don't shoot a person and then ask the person what they did wrong. If it was really about the crime, they would have shown the receipts. 2, the money's already gone before anyone has proven anything. The pain lands now, the investigation, if it ever happens at all, lands later. That's not how you catch a fraudster, that's how you squeeze a hostage. And this time the hostage is not a billionaire. The hostage is the common people who can't afford healthcare in a country where healthcare is already ruined. And this is the oldest weapon in the government. Now zoom out, because this is bigger than Kennedy, bigger than this president, and bigger than this week. What you're watching is the power of the purse, the single oldest lever in any government. Whoever controls the money controls everything that the money touches. And Medicaid is one of the biggest rivers of money in the country. Federal cash flowing into every single state to keep poor people alive. Whoever sits at the top of that river can do something quietly, terrifyingly. They can turn a slow valve, not shutting it off. That's illegal. That's a headline. That's a court case. Just slow it, delay it, pause it, pending paperwork. And suddenly a state that fought you has $1 billion hold and a room full of scared administrators. You never had to pass a law, just had to control the tap. And right now they've already started turning it. Notice who doesn't feel this at all. Here's the sleight of hand, and it's the whole reason that this works. When you hear California and Minnesota lost $1 billion, your brain pictures the governors, Newsom, Walz, 2 rich, powerful politicians getting a bloody nose. And some of you are fine with that. But Newsom doesn't miss a meal over this. Walz's nurses still show up. The governors are not the target, they're the return address. The people who actually absorb the hit are the ones whose names you will never hear. The ones who will silently die in hospitals because they had to make the decision between getting an x-ray or just going back home because they couldn't afford it. Walz said it plainly that this punishes children, senior, and people with disabilities, not fraudsters. Newsom pointed out California's in-home program exists specifically to keep senior and disabled people out of the far more expensive nursing homes. The politicians is the headline. The hostage is a stranger, and a stranger that can't afford medical care. Let's meet the actual hostages. So let me take the hostage, a real person, because children, seniors, and people with disabilities is a phrase you scroll past. It's a 40-year-old with cerebral palsy whose in-home aid is paid by the exact stream of money. When the state's budget gets $1 billion hole punched in it, that aid's hours are what a state cuts first. Because the aid can't sue, can't hold a press conference, and can't fight back. That person did not leak a document, they did not commit fraud, they did not vote for anybody's enemy. They just happened to live in a state that the president wanted to punish. And they're the one who feels it first and worse. That's what a hostage is. Someone who did nothing, whose collateral damage, who suffers so that a message gets delivered to completely someone else. And right now, that person is you. It's not an incident, it's a campaign. And if you're thinking, okay, one bad Tuesday, maybe it gets reversed, look at the pattern. Because this isn't the first pull. The same administration was already withholding more than $1 billion from California and hundreds and millions from Minnesota from earlier this year. This new billion stacks on top of that. Same two states, same method, same word, pause with no specific rules for the play button. When it happens once, it's a dispute. When it happens over and over to the exact same targets with the same justification and no evidence at any point, that's not enforcement. That's a policy, and the policy is the money is conditional on your loyalty, and we will remind you of it whenever we like by turning off the tap. One pull is a mistake, a rhythm is a threat, and right now everything is rhyming. Here's why you should be scared even if you hate these states. Now here's the part I really need the people cheering to hear, because a lot of you are watching two blue states get squeezed and quietly enjoying it. Understand what just got built. A tool now exists, tested, functional, unpunished, where the federal government can choke the healthcare funding of any states that it decides is an enemy using "we are just checking the paperwork" as a cover and provide no evidence for it. The tool does not belong to a party, it belongs to whoever holds the office next. The exact machine being used on California today is inherited, fully assembled by the next president, who might be someone you'd hate and might be aiming at a state that you love. You don't judge a weapon by who is holding it today. You judge it by imagining it in the hands of the person you truly trust the least, because that day may always come, right? The nukes didn't matter until Russia got a hand of them as well, right? When the safety net becomes a loyalty test. So, step all the way back and look at what's actually changed this week. Not the money, the meaning. Medicaid was supposed to be a floor, a promise that says no matter who you voted for, no matter which state you live in, if you are poor and sick, the country will not let you fall through the cracks. That's the whole idea of a safety net. It's supposed to be beneath everyone equally. What this does quietly without a single new law is turn the floor into a lever. It says the net is still there as long as your governor behaves, as long as your state stays in line. The moment a right becomes conditional on loyalty, it stops being a right. It becomes a leash. And they just proved that the leash works. Worse than that, loyalty is whatever they define it to be. Whether that be the loyalty to the president, to the state, or like the people of Germany were loyal to Hitler during his reign. Doesn't matter. Loyalty will be defined by them, and it will be the only condition for your medical care. It's not your fault, but if you're silent, that is. So where does that leave you? Watching this with no $1 billion and no press conference on your own. Look, you didn't build this machine. You didn't rig it so that the poorest, quietest people are the ones that a government reaches for when it wants to send a message. That is not your fault. You inherited a system where power learned it can squeeze the people who can't squeeze back. But here's the responsibility part. This works exactly on one thing. You not paying attention. It's designed to be boring, documentation, compliance, a payment pause. It's built to make your eyes glaze over the fact that the hostage just stays invisible. So refuse the boredom, see the person behind the paperwork, say the true version out loud, not fraud, not revenge, but they made 6 strangers pay to win a fight. That costs you nothing, and it's the one thing that the machine can't survive. being seen clearly and being acknowledged. It's not your fault that they built it. It is your responsibility not to look away. I will be a part of the truth, and I will see you next time.